late on the slide review because we're waiting to get our system up and running. So let's start with question and answers. Let me review very briefly. We started out by talking about differential diagnosis. Because I wanted you to have a little bit of an idea of how modern medicine doctors think, how they approach a sick patient. First, trying to figure out what's the problem, that is, setting up all the possibilities, a differential diagnosis, and then collecting data. By talking to the patient, we call that taking a history, then doing a physical exam, okay, and then doing some laboratory tests, okay. And with all that data, then we use the term rule out some of the diagnoses in the differential diagnosis because they no longer fit once we collect more data. And eventually we get down to one diagnosis or maybe two. Okay, so our differential diagnosis is kind of our working hypotheses of what are the possible causes or possible diagnoses for the patient's disorder. Okay, and then we talked a little bit about how we categorize disease from the point of view of modern medicine. We talked about from the point of view of cause, from the point of view of pathogenesis. What does pathogenesis mean? Pamela, what does pathogenesis mean? Sorry? Disease. Patho means disease, correct. And what does genesis mean? Cause, yeah. So the book of Genesis, for those Christian people, is the book of creation. Okay? So Genesis means cause or creation. So this is the cause or creation, the cause of disease, pathogenesis. And it talks usually about a mechanism, a biological. Someone said biology. One of the women sitting here, was it Lama? Someone yesterday, I think, or the day before. Chukila said biology. Yeah, so it's a kind of biological mechanism for disease. That's another way to categorize disease. And we talk about based on organ, right? And what was the example? Which organ did we give the example for? Sorry? Again, please? Heart. Yes, we gave for heart. And what else? Lung. We talked about respiratory or lung diseases. Good. And briefly we talked about another, not really an organ. No, so that's different. Okay, good. And then we gave a case study. Okay, what's a case study? History, yeah. Sometimes we even call it a case history. Okay, it's like the story, a medical story of the person. Starting with symptoms, what did they say was wrong with them? Then what did we find on our exam, the signs? And then laboratory data, okay? And then coming to a diagnosis, or first a working diagnosis, a differential diagnosis, and then refining that to a diagnosis, and then treatment. Based on the diagnosis, a treatment, okay? So we talked about an actual case history, case study, of a patient that I saw on the evening of the 21st. Thank you. A young woman, a Tibetan woman who's from Ladakh, 21 years old, college student living in Delhi and going to school in Delhi, and presented with severe respiratory distress, right? Or severe, what's the other word? Yeah, Chingla. What is it? Dyspnea, exactly. And dis meaning difficulty, and pnea, we don't usually pronounce the P, but P-N-E-A means lungs. Yeah, you all know that. Good. Presented with severe dyspnea, difficulty breathing. Okay? And then we took her to the hospital, and within a half an hour, she stopped breathing. She just pooped out. She had no more strength or energy to breathe. We had to put a tube down, put her on a respirator, a ventilator, and we also found out that her kidneys were failing. And she had a lot of edema in her body, a lot of fluid backup. And when you see someone with fluid back up in the body, the two things that should occur to you right away, and are probably the most common, what are they? Kesala? What are they? You know. What do we talk about? Huh? What are the two most common causes for fluid backup? Edema. So the person gets too much fluid in the body. I'm sorry? Kidney failure. Good. And did our patient have kidney failure? Yes. Yes. And the other one? Yes, heart failure. Now we talked all about heart failure, right? Because the pump isn't working, so the fluid backs up and it goes into the body, okay? Good. And then we talked a lot about heart failure. We talked about, the clinical presentation. I showed you slides. Remember the chest x-ray? Remember the person with the ascites in the diagram, the big belly, the fluid backing up in the belly? And then remember the pitting edema, holes. Where's my holes man? I don't see him. Who was sitting over here and said holes yesterday? Yeah, boom. Boom, yeah. Boom said holes, remember? It's like when you push on the leg, normally the skin comes back up. But if it stays there like a hole, that's pitting edema. It means fluid edema. Okay? Good. And then we went through the vicious cycle, the physiology. Remember the physiology of heart failure. And we went through the vicious cycle. I gave you 2 different diagrams explaining how the body's attempt to improve the function of the heart as a pump actually does the opposite. It creates more problems. Okay, a vicious cycle. Okay, good. So that's what we did the last few days. That's a quick review. If we're able to get the slides showing, I'll show you the slides quickly, also so that Genla can see them. But you know that we passed out a copy. Did Genla get a copy of the slides? Does someone who had the extra copies? I think Lama maybe has. Anyway, when we get we have extra copies, we'll give one to Genla, okay, so he can also look at them. And also, let's give one to Tashi Dabala, your assistant professor. They made copies, and we passed them out, and we're going to give one both to Genla and to Tashi Dabala. Good. Great. So, questions, please. Please don't feel inhibited or shy because your dean is here, okay? He would love to hear you ask questions and interact. So would I. And you did a great job so far, You guys have asked wonderful questions and you've been very interactive. So let's continue that. Anybody have a question? Should I call in somebody? Kesala, question? Tia, Yuri. Oh, yeah, please. Do we have the microphone? Very good. Very good. And then next I'm going to ask Chuyingla. So please make a question. Yes, please.
Good morning, sir.
Good morning.
And my question is regarding the differential diagnosis.
Yes.
During the process of differential diagnosis, in our Sowa Rigpa,
Yes.
We also have we classify diseases or whatever through possession and things that science can't exactly explain, I guess.
Well, the first one was possession, like spirit, spirit possession. Yeah.
Like we call it deux, right?
Yeah.
So is it is there a possibility that during the process of differential diagnosis, in your field of study, that they take into consideration that something like a spirit or something might have possessed and it could have led to the disease or something?
Yeah, very good question. Doctors in the modern medicine are not all the same. Similarly, in Sowa Rigpa, all the doctors they're not the same. Your Genla practice is different than Amji Dunila. Yeshi Dunila. Di Keprayu. Your Genla and Amji Yeshe Dunla, they don't practice the same. Also, Amji Tamdenla, the ex-director from Menzikong, he does not practice exactly the same as your Genla or as Amji Yeshe Dunla. Okay? I knew Dr. Tenzin Chodala. When I was working at Menzikong about 20, almost 30 years ago, we were working with Dr. Tenzin Chodala, okay, doing some research together. He does not practice the same as the other doctors I've mentioned. So even within Sowa Rigpa, the doctors have different styles, Kesala, okay? So within modern medicine, most doctors would not consider spirit possession as a valid cause for disease. But I would, because I've been exposed for many, many years. I'm a Buddhist monk, and right? So, but in general, it's not part of the modern medicine tradition. Maybe it will in the future, but currently, modern medicine is based on kind of modern science, and modern science believes in the physical reality. The mental reality or spiritual reality is generally not a part of modern medicine. But things are slowly changing, and I'm trying to get it changed also, because I think that's one limitation of modern medicine. It tends to not, value things like spirits, although some people say spirits are kind of superstitious. And I think there's some truth in that, If we're raised with it, from childhood, and so we believe it, and we get frightened usually by spirit, or domde. We get frightened, So some of it may be superstitious, but I think there are spirits. There are disembodied beings. I mean, Buddhism, the Buddha told us that, right? I also think that modern medicine tends to downplay the role of emotion in disease. Either the cause of disease or a reaction to disease. Either way, it becomes very, very important in the life of the patient and the patient's family, emotions. So that's something that I'm trying to bring more awareness to in medical schools and hospitals around the world, modern medicine. Particularly compassion, the role of compassion. So we're going to talk more about compassion in just a couple of minutes. Okay, thank you. Please, Chinla, you have a question? You have 2 questions? She probably has 3. She's very bright. She thinks a lot, and she's very smart. Yeah, please. I embarrassed her. I apologize. No question now? Okay. We'll come back to you, okay? Okay. Questions, please? Someone? Yes. Yes, please. Please. I'm sorry, I don't know your name. Wanchula. Yeah, please.
First of all, I'd like to wish everyone to set.
Thank you. But Wanchula, it's morning.
My question is related with the heart failure.
Uh-huh.
Is there any mutual interconnection between heart disease and mind?
In mind.
I mean,
Yeah.
based on the cause and effect.
Yeah. Very good, very good. The answer is yes. Yes. Yeah, I'll explain. For a long time, modern medicine has recognized something we call type A personality. Have you heard that term before? Type A personality. Have you heard it? It means someone that's very anxious and angry, fearful and angry a lot. You know people like that little things, they set them off and they get angry. Okay? Maybe some of you are like that, I don't know. And we've found over the years that type A personality is associated with more heart disease, particularly heart attack. Heart attack is when a portion of the heart muscle dies because it doesn't get the blood supply. The blood supply of the heart muscle comes through 3 major arteries that supply the heart muscle itself, called coronary arteries. Okay? There's a right one, a left one, and a what we call the left anterior descending, LAD. It comes down the front of the left ventricle of the heart. And that's kind of the main blood vessel, along with those three, that supply the blood to the heart muscle itself. If one or more of those coronary arteries becomes blocked, then the area of heart muscle that's supplied by that artery that's blocked dies. Okay, and that's called an infarction. Just means that it dies, that the portion of the heart muscle. Okay? And that's why we call it an MI, or myocardial infarction. Myo, what does myo mean? Excuse me? No, myo. Muscle. Chingla, Shinu, yeah, good. And cardio? Good, Pimela. Heart. So it means the heart muscle. Myocardial means the heart muscle. Infarction, what does it mean? I just told you. You're still asleep? What does it mean, infarction? Sorry? I'm sorry? Yeah, okay. I just told you. Maybe it was too much or I spoke too fast. It dies. Infarction means the tissue dies. Okay? So it means a portion of the heart muscle, myocardial, dies, infarction. And that's what we call a heart attack. Okay? Now, if it's a very small portion of the heart muscle, kyunmeba, no problem. Okay? If it's a very big area of the heart muscle, kyunchenbo. Okay, big problem. Because that part of the heart muscle won't contract, it won't pump. And the job of the heart is to pump the blood, right? Okay. So there is definitely a connection between anger and heart attack. We call that a type A personality. So for that kind of patient, we can give all kinds of drugs and this and that, and it won't help much. What's the most important treatment for that kind of person? Mochila? Sorry? Peace of mind, exactly. So it's our job to try to help that patient, find at least some peace of mind. Hard to do, but we try. So how are we going to try to help that patient find peace of mind? What are we going to recommend? Sorry? Sheila, what are we going to recommend to find peace of mind? Sorry? Compassion. Yeah. Not easy, but we're going to try to educate the person how to be more compassionate and less selfish. Good. Wonderful. Good question, Wanchila. Thank you. Very nice. Okay, anyone else have a question? While we get our... Yes, please. Kesala. Good morning again.
This question is from Hatsundas.
Yes.
I'm just trying to interpret it.
Yes.
English. So,
thank you.
This question is that in our system, in Sowa Rigpa, there's a in the text and other texts also, even in Chinese medicine, there's a direct correlation between the tongue and the heart. Like we can tell what do you say, like how the heart is doing through the tongue, like we can
tongue, yeah,
cracks and etc.
yeah,
So,
yeah.
In one medicine, is there any kind of correlation or anything that says there's a relation or anything like that?
Yeah, very good question. Thank you. I don't know. The tongue, I'm not sure of a connection with the heart. There might be, but I don't know of one. But something that doctors have found over the years, and we don't know why, but sometimes the earlobe, there's a certain shape or a notch. You know a notch? Almost like a cut. Not exactly a cut, but an indentation. So like a hole, like, who was telling us the hole again? Who was our... Oh, yeah. Boom. Bumla was telling us about the hole in the, for the pitting edema, right, in the leg. So similarly, it's like there's a little hole almost in the edge of the earlobe. And there has been some correlation with heart disease. We don't know why. Tongue, I'm not sure. The other thing is there are certain structures in the nail that also they've related to some kinds of heart disease. Generally, we don't pay too much attention to that, but maybe in the future we'll learn more about the connection of the nails, the earlobe, and who knows, maybe even, like Sowa Rigpa, the tongue connection to heart. But currently I haven't heard anything about the tongue. Very good. Thank you for that question. Great. Do we have other questions now? Please, Genla. Yes, please. Do we have a microphone? Genla, di tia yorme? Oh, yeah.
Since you're a Buddhist monk,
Yes.
have you experienced, from your experience all these years being Buddhist and also being a doctor, have you ever seen a patient for whom Buddhism has helped cope with their illness or help them treat the illness better?
Yes.
Have you ever experienced, or have you ever seen, or have you ever heard patients say something like that?
Yes, many times. My personal experience. So I don't push anything on anybody, but those that are interested, and they see me as a Buddhist monk, right? So many people are interested in meditation. So I teach a lot of people how to meditate. I recommend programs or whatever if they have interest. So that's something I use a lot. But the other thing I use a lot is compassion. To me, that's a central part of what I do. Okay? Not only do I try to practice compassion, I'm not always good. Sometimes I blow it, but I try. And also I try to teach people how to be compassionate. Now that's not uniquely Buddhist. Every religion, practices compassion, but it's also there very much in Buddhism. And a third thing, which, this is a great question. Thank you. In some parts of the world where there's a Buddhist culture, and I'm invited to the medical school. So one example is Mongolia. The students there have learned that I'm interested in Sanjimela, the medicine Buddha. And so I don't give initiation, but I give a kind of a lung, and we practice the mantra and a little bit of practice about Sanjimela, medicine Buddha. And I've been doing that every day for 35 years or something. Something like that. And I'm convinced that that's made me a better doctor. And I tell that to some people. I don't broadcast it because a lot of people think that's weird as a doctor. What's he doing? Is he crazy? But among my friends and people that would understand that, even doctors, I share that information. And now I have doctors coming up to me and they want to learn more about medicine Buddha and they want the mantra. So yes. But again, I don't push anything. If someone is not interested in Buddhism, I certainly don't push Buddhism on them at all. But if they have interest, then I share these things, yes. And I think it does help to reduce some disease, particularly stress-related diseases. And it may help, not sure, but it may help prevent stress-related diseases. Remember I talked about lupus, which is a joint disease, autoimmune. I think Dalai had asked this about autoimmune disease. Yeah. Lupus, affecting mostly women, 90% women, and I don't know why. Yeah, mostly women. She asked why more women. But there seems to be a significant emotional traumatic event, a little bit before the diagnosis of lupus. And so maybe if we teach some meditation and compassion to people like that who have significant emotional stress, maybe it would help prevent those kinds of diseases. Not sure about that, but maybe. Good. Please, yes, please.
About the Morbu Sudek, the Morbu Sudek.
I don't know.
The Morbu Sudek is when some patients had an operation maybe at the ankle and the hand.
Yeah.
and then they become a very strong inflammation.
Oh, I
And
see.
I heard, but I have not an idea that
Hmm.
is maybe same what you now explained about the connection with the mind.
Hmm?
They are maybe inside angry.
Yeah.
And this is maybe the result after the operation that they have become a very hard inflammation.
Oh.
They are not able to move now the
Yeah.
ankle.
Yeah.
That was my question. Is there a connection of maybe the same, like
Yeah.
this what you explained?
Yeah, I don't know the answer for sure, but my strong suspicion is yes. Because we know that anger weakens the immune system. There's good data, there's good research that shows that anger and some other negative emotions, okay, they weaken the immune system. His Holiness the Dalai Lama in English sometimes says anger and ngumompa, the destructive emotions, eat up. He says eat up the immune system. So weaken or can partially destroy the immune system. And if the immune system is not working after surgery, then one of the manifestations is swelling. Exactly. So very possible. I don't know for sure, but very possible.
Yeah, same I heard. Yeah.
Mhm.
Thank you.
Good, good. Yes, please. Chunlai, have you come up with a question yet? Not yet. Okay. Who else? Yes, please. Please. Tell me your name.
I'm Pasang Doma, Dr. Pasang Doma.
Dr. Posandromala. Tashitale.
I've heard of new organ which is recently discovered, or I think they found out one new organ, mesentery. Is that new organ?
Mesentery.
specific?
Yeah, that's a very, very good question. The mesentery refers to the GI system, the gut. Gyuchen primarily, but Gyuchung also, both. Mhm. And we talk about mesenteric artery and arteries, which are the arteries that supply the blood to the colon, large and small, Gyuchen, Gyuchung. And in the past, we haven't paid much attention to the GI, the intestines very much, unless somebody has significant disease. But in the last few years, we're realizing that the bacterial, we call it the biome, the bacterial mass in the colon is actually extremely important. In fact, it's probably the most important immune system in the body related to the bacteria. And so now there's a lot of research on the bacterial components, which bacteria and proportions, and their function in the colon. So that's a new area. Not quite a new organ, but some people may call it a new organ, but it's a very new area of interest that seems to have a huge influence, particularly on our immune system. Good. Thank you very much. Yes.
To this question, I'd like to ask something more. What do you think about the stomach or the colon? I don't know which exactly part is they like to say to them. Is the second brain maybe? I heard this. What do you think about that?
Yeah, that's just what we've been talking about. I mean, it's, now we're beginning to recognize that other areas of the body, other than the brain and nervous system, have tremendous control over what happens in the body. And one of those other areas is the biomass in the colon of the bacteria. That's one. Another is the endocrine system that we talked a lot about. We talked about the different hormones, right? The female hormones, the male hormones, so-called sex hormones, the thyroid hormone, the adrenals, remember on top of the kidney? I think this was, who mentioned this? Was it Dalai? Yeah, the adrenals sit on top of the kidneys, and they make like the cortisone and other hormones. We talked about neurohormones, right? When we were talking about this vicious cycle with the heart failure. We talked about the neurohormones like adrenaline that kick in. They're actually made by the adrenals sitting on the kidneys like this, okay? But they're stimulated or caused, or they're stimulated by the brain. Okay, so they're called neurohormones to try to help the heart to work better, but they backfire. Do you know the word backfire? So what's the word you told me for dog choke yesterday? For vicious cycle? Huh? Tell me louder, I can't hear. Again? Again? Korchu Lopa, opposite, like Korchu Lopa. So it's like Korchu Lopa. Okay? It tries to help, but in fact it causes more problems. Okay? The other is the genetic system. Okay? We're finding out that epigenetics is very, very important. What's epigenetics? It's a new field. What's genetics? What's genetics? What's genetics? Genes, good. And what are genes? What do they do? What's the function? Huh?
They're the base of everything.
Base of everything. Tell me more specific. Yeah, they carry the information for the offspring, mother, father. Good. And what do they do then? So how are they the basis for everything? You're right, Kerzin, but how do they become the basis for everything? What's their function? What do they make? Chromosomes are a bunch of genes together. Okay, so what do they make? DNA is what they're made of. That's the small bit. If you unravel the gene, you get DNA, deoxyribonucleic acid, just a big chemical, yeah. It's a double helix, okay? And what does it make? If you went to the DNA factory and you went to the showroom, what's in the showroom? What are they making? Huh? Stand up. Stand up. Again? Yeah, you don't get a gold star, you get a diamond star for that. Good. Protein. They make protein. And why is protein the basis for everything, Kerzin? What's everything made of in the body? Huh? What's everything made of? Go ahead, just guess. It's okay. Cells. Right. And what are cells made of primarily? Huh? Protein. Everything in the body is made of protein. Okay? Some things are made of fat, and there are some carbohydrate, okay? But primarily all the structural stuff, the muscle, the bone, the structural part of the brain, of all the organs, it's protein. Okay? So where does protein come from? What's making protein? Huh? DNA. And what's DNA? Genes. Okay, if we take a bunch of DNA and we kind of put it together, like a ball of yarn, we put it together, that's a gene. If we put a bunch of genes together, what is it? Chromosome. Good. Good. So that's the stuff that comes from both parents, like Bumla told us, and it makes protein, which is the structure of the cells, which is the structure of the body. Okay, now, that's genetics. What's epi? Huh? What's epi?
Epi or epi?
Epi. What's epi? It means kind of, what does epi mean? It's sort of like meta. You know meta? It's kind of over, above. A little bit like controlling. Epi in this case means controlling. It's controlling the genes. So what does that mean? It's controlling the genes making protein. Okay? So we call that regulation. That's the word, regulation. And what is it regulating? Sorry? The genes. For what purpose? Making protein. So here's the technical terms. On and off. Okay? So it's genetic regulation, regulating the genes, turning them on or off in terms of making protein. Okay? So you may say, well, so what? That's important. Okay? Because it influences then the cells, making new cells. It's very, very vital, important. Okay, so that's epigenetics. Now, why am I telling you this? Because there's some new research. It's still very new. Some of it's coming out of University of Wisconsin-Madison and some from Barcelona and some other places that shows or suggesting early that epigenetics is being regulated. Primarily, it's the physical functions. This is something we all know. I mean, the scientists know. pH, acid, base, okay? Temperature, pressure, those things. Physical chemistry stuff, okay? But it's also being regulated by love. Really? Some research has been demonstrating that. It's being regulated by meditation, being influenced by meditation and positive emotions, love and compassion. Jampa Ningje. Good stuff, huh? So this is another, if you will, main system in the body that controls a lot of things. It's controlling, making new cells, protein. Okay, very important. So some of the cells that are quickly turning over, like blood cells, red blood cells, every 2-3 months, they're gone, they die. Yeah? So the body has to make new ones. So epigenetics is helping to regulate that. The more love and compassion we have, I don't know if this is true, but it would be great research to see if we can improve anemia, which is low red blood cells, through practicing love and compassion. It's possible. It's possible. I don't know. Just an idea for research, okay? Good. So let me just run through this very, very quickly because I wanted some of the people here, your professors and teachers who haven't seen this. So I'm just going to go very, very briefly, and you'll have handouts of all this, just so you see it in color. Okay. Can I give you this, please? Lamalan? Tamala. Thank you. Yeah, thank you very much. Then I can use the slide changer. Battery is working. Yeah, yesterday it was kind of on and off. So maybe I'll use this. Yeah, okay, thank you. Thank you. Can you get me back in the slideshow?
Slideshow.
Yeah, hit this guy right there. Yeah, and I'll just control it from here. Should work. Yeah, okay. So here are just different ways to classify disease by cause or pathogenesis or symptoms. For example, cough. Your Genla and I have a cough, so we could then make a differential diagnosis of all the possible causes of cough. A cold, influenza, TB, lung cancer, on and on. He doesn't have lung cancer, I don't have lung cancer. He does not have TB, I do not have TB. We both have colds. But we could classify diseases or make a differential diagnosis based on symptoms also. And here's an example by cause of infectious disease, the different organisms. Okay, you have this in your handout. You all know this. I'm going to move quick. Pathogenesis, we talked about this biological mechanism. In other words, the process of causing a disease. We can classify diseases based on pathogenesis. And we talked about different categories of pathogenesis. And I apologize. On your handout, did this come out okay? I think it's just on this setup. Did this one come out? Everything's in nice line on your handout? This slide? Huh? Yes, okay. It was just our machine here that wasn't so compatible. So infection, inflammation, malignancy, and degenerative were some examples of pathogenesis, ways of categorizing diseases, okay? Whoops, sorry. And then organ system. So I think we talked about respiratory system. Yeah, so for example, here's a differential diagnosis or a category of diseases based on an organ, the lungs. What's COPD? Tell me what COPD is. You remember? Chewing lung. Chronic obstructive pulmonary disease. Good. Who gets that? Which patients are most susceptible? Smokers. Chronic smokers, exactly. Good. And then other different diseases of the lung. And then these are just other ways of categorizing disease based on infection or inflammation. What does neoplastic mean? Huh? Cancer. What's another name? Malignant. Yeah, good. And another name? Yeah, carcinomas and sarcomas. Very good. Okay, good. And degenerative, we had a lot of talk about degenerative problems. We talked about the knee, talked about the brain, okay? And there was a question about congenital disease and degenerative disease. What was the same or different kind of stuff? Okay, good. And then congenital, and then drugs. I think we mentioned, heroin and cocaine, I think. Cocaine, I talked to you about a hole in the septum, right? And heroin, you know all that stuff, I think. You guys know all that stuff? No, you don't? Okay, you do. Okay, good. It's good for you to know. I don't mean personally, but, but to know about this. Because some of your patients will come in with these problems, yeah. Unfortunately, it's, happening everywhere, even the Tibetan, exile situation in India, everywhere. So as a doctor, you need to know about these things, okay? About, yeah. And this is another, continuing the list of how we categorize, another categorization of disease: autoimmune, allergic, traumatic, which means accident, right? And then endocrine, right? We talked about the thyroid and the adrenals on the kidney, the sex hormones, that's all endocrine. And metabolic are like biochemical changes. Some of these are congenital, okay? Yeah, okay. And then environmental, we know about that. I think we know about that. Good. And then this is the case study, the 21-year-old Ladakhi, a Tibetan young college student who lives in Ladakh. And I was called to see her, and she was breathing extremely difficult, labored breathing. She couldn't catch her breath. We took her to the nearby hospital. We found a good max, not too far, in Delhi. And her blood pressure was initially high, but then it fell, okay, and became low after a while. Her pulse was 170. What's the normal tsatsam cutoff? 100. Good. What's the normal cutoff for blood pressure? Yes. Again, everybody. Good. Please don't forget. It's important. Good. You'll be checking blood pressures if you're not already. You will be. Good. And she was not in atrial fibrillation. Remember atrial fibrillation? Bum ba 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 ba. Irregular. She was not in that. She had a normal sinus rhythm. Okay. What's CXR? Huh? Chest X-ray. Good. You'll see that abbreviation a lot. Okay. Good. Pleural effusion, water in the lungs. Okay, actually between the lungs and the chest wall, but you could just say roughly water in the lungs. Okay. What's cardiomegaly? Cardio? Heart? Megaly? Big, good. Big heart. Very good. Great. And on exam, she had an S3 gallop. What's that? Heart failure. What does it sound like? Horse is galloping. Dun 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 dun. It has three sounds. Dun 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 dun. The heart sounds normally da 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 da. What does a gallop sound like? Da 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 da, like a horse. Okay, good. So if you put your stethoscope on the heart, you may not be sure, but if you say to yourself, "Boy, that sounds like what horse is galloping," think heart failure. Okay, good. Very good. And what are rowels? We usually call them crackles. It's like crackling. You take a little bit of cellophane paper and you squeeze it. A little bit like that. Okay? Means fluid. Okay? Fluid. It means this pleural effusion. It's not exactly pleural effusion because that's outside the lung. When the liquid is in the lung, then it crackles. Because as the lungs expand, remember they're little air sacs, they kind of go crack, 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 because they've got water in them, fluid. Okay, so that means that there's water actually in the lung when you hear rowels or crackles, okay, with a stethoscope. Good. Okay, she had pitting edema. Remember the holes that Boom was telling us about? Okay. And I'll show you pictures. And she was not making urine. Oops. And then she stopped breathing. Respiratory arrest. Arrest in modern medicine means stop. Gok. Okay? So it means she stopped breathing. If somebody has a cardiac arrest, what does that mean? Huh? Again? I can't hear you. Heart stop. Yeah, stops. Good. We call that asystole. So on an EKG, or you call it an ECG, flat line on the heart. Okay? The heart's not beating. It stopped beating. That's cardiac arrest. And that's when you do CPR. What is CPR? Yeah, and what is, that's exactly right, chest compression. And what does CPR mean? You know. C? Huh? Chest could be chest, but here it means cardio, heart. Good. And P? Pulmonary. Good. And here just resuscitation means you're trying to get the heart going again. Yes, and you push on the chest. Yeah. Good. Whoop. What's the normal creatinine? This is the measure, blood test for kidney function. What's the normal? Excuse me? Who said 1? Close. 1.5. Usually in India they say in the labs 1.5. In America we usually say 1.3. So somewhere there. And so her kidneys are not functioning because she has like only probably 10 or 15% of normal function with a creatinine of 5.5. Okay? Okay, what's dialysis? Sorry? Filtration? Yeah, kind of. It's an artificial kidney, isn't it? It's a machine that filters the blood when your kidney's not doing it, when your kidney has failed. Good. What's ICU? Intensive care unit. Wonderful. Who goes there? Nobody goes there. No visitation. Who's put in the ICU? Very sick patients, right? Very sick patients. They need a lot of monitoring. Good. The next morning, she was doing better. We thought she might die in the night, but she did not. And she was sitting up, and she had been extubated. The tube had been taken out because she could breathe on her own. Good. And she was reasonably comfortable. She was frightened, but she told me no pain. And I asked her if she remembered what happened, and she said yes. So that must have been very, very frightening for her. But she was alive, and she had no pain. She was sitting up, reasonably comfortable. She's continued to have dialysis. We're looking for among family members, a kidney donor, so that she can have a compatible, we call it HLA, which is one of the systems of checking tissue compatibility. So we're looking for a donor among her family members in Ladakh. And she also, along with her kidney failure, she also had, of course, heart failure, right? And her ejection fraction was 20 to 25%. What's normal? 55 or 60%. Yeah, good. Good. So her heart wasn't pumping very well, was it? And that's why all the fluid was backing up. Good. So we went through this in detail the last couple days, so we'll just briefly here And then Booms holes, pitting edema. And then this again, okay? Talking about all the different signs of heart failure. Chest X-ray. What are we seeing on this film? Tell me. Big heart. Good. What do we call that? Cardiomegaly. Good, Chingla. Cardiomegaly. Or you can just say big heart. That's fine. But the doctor's terminology will probably be cardiomegaly, the modern medicine doctors. And what else do we see? Fluid. Yeah, there's fluid in the lungs. That's what all this stuff is, fluid. And normally we see a nice sharp angle, black here, same as this color. Here, we lose it. We lose the angle. Okay? It's called a CP angle, cardiopulmonary angle. It's lost because there's fluid there. In fact, here we even see it kind of like that. And then when you see it curving, that means fluid. Maybe we see it here, not so clear. But all that obscuring the nice, good angle. I don't have a normal one to show you, but that means fluid. Correct. Big heart and fluid in the lungs. Good. That means pretty much congestive heart failure. Okay? Could be other things, but mostly that's congestive heart or heart failure. Heart failure. What's this? Jugular vein distension, JVD, right? Because the heart is not pumping, the fluid's backing up. And one of the places it backs up is in the neck veins. Good. It's a sign of heart failure. Pitting edema, right? Good. And then we talked about the physiology, that it's common. In 1997, there were 6 million people in the U.S. and 23 million worldwide who have, at that time, had heart failure. Okay, it's quite common. The numbers are increasing as the population ages. And then we talked about class 1, 2, 3, 4. And class 4 heart failure is when the person is basically bedridden. Maybe can get up to the toilet at best. They just don't have the ability to do any exercise or any work, even walking. Okay? And those people don't live very long, so it's very serious. Class 4 heart failure, people live months, maybe a couple years. So it's in some ways worse than cancer, okay, in terms of longevity and in terms of function. They can't do anything. You know, they're in bed, they have oxygen, and they can't do much. Okay, it's very sad. Do you think Tibetan medicine can help? Yes? Other people? You think there's a possibility that Tibetan medicine can help in this condition, heart failure? There's no modern medicine. I mean, we just support them, oxygen, and make them comfortable. We have no, direct medicine to improve the heart. Anyway, maybe that's something we'll do some research on. Not sure. It's an interesting question. I kind of suspect that maybe, but I don't know much about Sowa Rigpa, And this is the pathophysiology. Either the heart cannot receive the blood, or in most cases, it can't pump it adequately. So fluid backs up, and that's heart failure. That's the pathophysiology. We talked about that. And the vicious cycle, starting with a big heart, chamber dilatation, okay, leading to stress in the wall, and then the pump is not working. Ventricular dysfunction, the pump is not happening very well. And then the body tries to compensate with these neurohormones, and they just make the situation worse. They shut down the kidneys, and they shut down the arteries. The arteries constrict to try to hold the blood pressure. It just makes more of a problem in the pump, a vicious cycle. Okay, we talked about that. And we showed you a picture. We won't do it now, but I recommend, if you haven't seen this, to go to those sites. You'll see the actual beating heart. Those are nice sites to actually see the beating heart. The second one is a little bit bigger. It shows a bigger picture. The second one is better, but both. Okay? And you have them in your handout. And there's just a cross-section of the heart showing the 4 chambers. This is the right ventricle, left ventricle, and then the right atrium, we don't really see it, and the left atrium right here, the two small chambers. We talked about the 4 valves that connect the 4 chambers. And what kind of valves are they? One way. Good. Good. One-way valves. Good. So it's like the door opens and then closes. So the blood only goes in one direction. The door doesn't stay open unless it's a diseased valve. Okay? Good. And these are just characters from Old Chinese for heart, which I thought were kind of interesting. And from Georgian language, this is for heart, the character meaning heart in their script. Leonardo da Vinci, 15th century, he was very precise in his anatomic drawings, and this is his drawings of the heart. And this is another, showing this vicious cycle, how the body's attempt to make things better through these neurohumoral or neurohormones actually makes things worse. Okay. Please join me in Facebook, okay, for this teaching site, Altruism Medicine, which is our non-profit, which is trying to bring more compassion in healthcare. And then this is our group in Japan, Human Values Institute. Good, and you have all that. Good. So I went a little longer than I was planning, but we just went through that again because I want you to try to, remember that as best you can. It'll help you later on when you see patients that come in particularly with heart failure, which is very common. Also with kidney failure, less common, but you'll see some people. Now you have some of the terminology and some of the understanding. Good. Questions, please, and then we'll talk a little bit about compassion. Please.
Good morning, sir.
Good morning.
My question is about the fluid that get inside the legs of.
Good.
So
Yes.
Will the fluid ends up being the disease called elephantitis?
Uh-huh.
And my second question is, I just want to know the term. What is ischemic heart disease?
Good. Very good. Thank you very much. Ischemia means reduced blood supply. Okay. So another name for that is angina. Angina is when the person feels heart pain or chest pain, and then on the tests it's found that the arteries, the coronary arteries, are partially or fully blocked, usually partially blocked. So the heart muscle, one area of the heart muscle is not getting enough blood and therefore not enough oxygen. That's ischemia. That's ischemic heart disease. So the other name for that disease is, and it's very, very common, we call it coronary artery disease, CAD. Because here it's based on etiology or cause. So the cause of the ischemia is the arteries are not getting enough blood and oxygen to the heart muscle. Why? Because the coronary arteries are partially blocked. Okay. And the elephantiasis is a parasitic disease that involves the lymphatic system. So it'll only be on one side. I mean, I guess there are cases bilateral, but generally it's one side. So one leg will be extremely swollen, extremely. Okay? Now that's a problem with the lymphatic drainage. The lymphatic system is blocked, probably because of the parasites. Okay. What we're talking about here is not fluid because of blocked lymphatics, but rather the heart is not pumping. And you remember this is a closed system. The heart, the arteries, and the veins, it's all a closed system. So if it's not pumping the blood adequately, some of that blood will back up and it'll leak out of the blood vessels and go into the tissues. And it's dependent. In other words, it depends on gravity. So if we're sitting or standing, all that fluid will go down in the legs and the tissue of the legs. causing this edema or pitting edema in the legs. If we stood on our head all day, our head and our arms would get pitting edema. So it's gravity dependent. Good, very nice. Yes, please. Thank you. Thank you very much. Please.
You spoke about the beta or the API.
Epi, yes.
Yeah. The genes who making the proteins or regulating the proteins.
Mhm.
And my question is about Parkinson, morbus Parkinson, the on and off phenomenon, or what is it? Yeah, on and off phenomenon. So is it that there is in the brain some cells are died, and this is maybe one reason, is my question. And the other one is there is too less protein maybe in this part of brain that the Parkinson patients are not able to walk in a normal way, or they have what is this, shaking all the time? Is this one of the cause?
Yeah, Parkinson's disease is a problem in the center of the brain. It's in the thalamus. So that it's actually in the, what's that area called? It's near the thalamus, the thalamus is in the center of the brain, one on either side, right and left hemispheres, and it's kind of the gateway. It's like Grand Central Station. It's like Mughal Sarai. Okay? All the trains come into Mughal Sarai and then they go in different, it's a junction. So the thalamus and the area around the thalamus, which is the area in the brain that is involved in Parkinson's disease, is like the junction, okay, like Mughal Sarai, or like Grand Central Station in New York, okay? And so all the information goes up and down through the thalamus, which means from the cortex, which is the thinking part of the brain, okay, the information is going down, okay, out to the body through the spinal cord. And similarly, the information from the body is coming into the nerves into the spinal cord and up to the thalamus and up to the cortex. So it's kind of a place where all the information comes through. And that's the area that gets damaged in Parkinson's disease. And why then it causes so it causes a number of problems. One are tremor, or shaking, tremor we call it. Okay. It also causes problems in speech, so it affects the nerves of the speech, the tongue, and possibly, I'm not sure if it affects the vocal cords, but the tongue and some of the muscles around the mouth for, helping us to make speech clear. Okay, it affects those things. Often people get a kind of gait or walk, which we call shuffling. So you see this sometimes in older people. They don't take big steps. They take little steps, kind of like okay. They lose their balance easily. So the balance system, more in the back of the brain where it affects the balance. Those are all affected in Parkinsonism. So epigenetics is something happening in every cell of the body. Okay? Because every cell has a nucleus. You remember that? A few years ago I taught about that, but you guys weren't here. That was before you came. And the nucleus is made up of what? Where'd Dalai go? Okay. Who gave me genes? Who said genes? Wanchula? No. Who said genes? We were talking about genes? Huh? Boom. Yeah, boom. Talked about genes. Not blue jeans, but genes. And one of your professors talked about DNA, okay? So these are things that are in the nucleus of every cell. So epigenetics is happening on the level of the DNA in every cell of the body, regulating or turning on, turning off the production of protein. Good. And presumably, when there's meditation and positive mental states, quote-unquote healthy protein is being made, and unhealthy protein production being stopped. We don't know that, but presumably. Okay.
And one last question to the Parkinson disease. I read for a few years ago that is for the patients, one of the first signs is then when they have different smelling in the tongue. This is maybe one of the first signs that they have the Parkinson. Because you see the symptomatics maybe when it's too late, many years later, but this disease was starting maybe 4 or 5 years before. And one of the first signs is what I read is that the patients tell the doctor, "Oh, I smell different now, some things." So maybe this is one of the first signs. Do you know about that?
I don't know about that. I'm not sure about that. Good. Yes, please.
Related to the Parkinson.
Yes.
And recently I read an article about Parkinson disease.
Yes.
A researcher who researched about one of the Parkinson patient who's cycling.
Mm-hmm.
Okay. After 15 minutes, the sign and symptom are stopped. This became a normal.
Mm-hmm.
After for 15 or 10-15 minutes, it's repeating.
It's what?
Repeating
Repeat.
the sign and symptom.
Coming back again.
The
Yeah.
shaking and
Yeah.
So,
Yeah.
in modern medicine, is there any answer for that? During the after the cycling, the signs and symptoms are stopping.
Yeah, I mean, there's, I think, kind of an explanation. So we talk about some physiology, the gate theory. We talk about this mostly in the context of pain. Okay, and gate meaning that some information is let in and some information is kept out. So what basically is happening, I think, with the cycling is the mind is being keyed into this exercise, and in a way, it's keeping out the information that is the dysfunctional information in terms of our fine motor function or our movement. Okay, so I think maybe something like the gate theory might be an explanation, but again, I don't know for sure, just a guess. Yeah, interesting. So there's something called phantom limb pain, phantom, P-H-A-N-T-O-M. Phantom means ghost, kesala, or spirit, right? Kind of, I mean, not exactly, but it's in this context, it means it's actually not there. Okay, so it's like water in a mirage. It looks like it's there, but it's not, right? That's an example the Buddha used to describe reality, right? That appearances are not real. But in this context, phantom means that it seems like it's there, but it's not. So phantom limb pain, these are in patients that have lost a limb. Amputation, they've lost a limb, okay? Or they had an accident. And they still feel pain in that limb that is no longer there. That's why it's called phantom. And this is very interesting because work with people that have phantom limb, they try to get them to think about other things, basically, to see if they can relieve that phantom limb pain. And I think they've had some success for that. Maybe a similar kind of phenomenon to the loss of the dysfunction after cycling for 15 minutes in the Parkinson's disease patients. Maybe. But, yeah. Okay, so we're almost out of time. May I have 5 or 10 minutes to talk about love and compassion?
Yes, please.
Okay, I'm going to make a request. And that is that you please remember that an important part of being a doctor, in fact, a very important part of being a doctor, is to practice love and compassion. Okay? We can have the greatest technical knowledge. We can be the best person reading a pulse, looking at a urine. And if we're not kind to the patient, it's less chance that the patient will get better. It's less chance that the patient and the family will be satisfied. And it's less chance that you will be happy as a doctor. Okay? So your relationship with the patient is extremely important for all these things. For the well-being of the patient, patient's family, for you, and that means your family also, your relationships in your family also. So love and compassion become a very important part of any kind of medicine. whether it's Sowa, Rigpa, Chinese traditional medicine, modern medicine, Ayurveda, on and on and on. Very, very important. So I ask you, please, particularly you all, because many of you have some understanding of Buddhism, and you have some belief or faith in Buddhism, and compassion is a central component. Those of you that may have other religious faiths, compassion is also a central component in those religions. And for those of you that have no religious belief, okay, you're a human being, okay? So to be a good human being on this earth, it's mandatory that we have love and compassion. So I request you all, when you're treating a patient, to see that patient as if it's a younger person, as if it's your son or your daughter. If it's someone roughly your age, as your sister or your brother. If it's someone older, as Amapama, as your mother or your father. Seriously, okay? You don't have to say this, but in your heart. Then you'll have respect and you'll really treat that person kindly. Okay? So important. I can't emphasize that enough. And so many doctors, from whatever tradition, medical tradition, go out and they practice and they kind of forget that. Maybe it's too busy or they have other stresses going on, and they forget the kindness. So please don't forget that. Very, very important. It's probably even more important than knowing about heart failure. Okay? If you don't know about heart failure, you can look on the internet or ask one of your colleagues. But if you don't know about love and compassion, then very difficult. Okay? Medicine is becoming more and more of a stressful profession. Do you know that? A lot of stress. Okay? Partly, we're dealing with sick people. Okay? People come to us because they're sick, and they're asking for help to get better. And some of the people that come to us with being sick, they're also depressed. They're afraid. They have anxiety, fear. They may be angry at the world. Why me? Kind of attitude. Okay? You're going to see people like this. So always love and compassion. Even if you feel you can't do much for them in terms of the traditional approach with medicines, behavior, diet, etc. It doesn't matter. Always be kind. Think of them as someone close and dear. And that will make you a better doctor. Guaranteed 100%. There's actually now good research that is showing that compassion actually helps the immune system. I mentioned this kind of earlier, briefly, or in a different way. Helps the immune system. And it also helps to cure some disease or make some disease better. Okay? I think they want the room or something. No. Okay. So, please, very, very important. Good. Any last questions that you might have about anything that we've presented? Please, now's the time to ask if you have a question that... In Mahayana Buddhism, and many of you are Mahayana Buddhists, we think about Tonglen. How many of you know Tonglen? Raise your hands. Tonglen. Tonglen. 2, 3, 4. Good. What does it mean literally, Tonglen? Literally, what does it mean? Giving or taking, lempa, and giving. Right? So what are we taking in the practice of Tonglen? Pain and suffering of others. And what are we giving? Love and compassion. Okay? So from that perspective, we can expand all beings and say that actually everybody's been our mother before. If we believe in reincarnation, or we have some feeling that maybe reincarnation is true, then who was our mother last life? We don't know. So who could it be? So please look to the person to your right. Go ahead and look to the person to your right. Look to the person to your left. Look the person to your left. Those people were your mother. Maybe not last life, but sometime before. So many times have been your mother. So every patient that you see actually has been your mother before. So please treat them with respect and kindness and love. Good. Thank you very much.
We have now come to the end of this lecture session. We'll now have a short valedictory session as a farewell to Dr. Berila. So first we have a few students who will share their experience. First I would like to invite Ms. Kamasiri of BSMS second year to share her experience.
Good morning everybody, and especially to Professor Berila for coming here despite having a cold and everything, and in order to teach us all. And on top of that, I think...
Do we have the handheld mic?
I can use this one.
This one, yeah, try this one.
As I said, good morning everybody, and especially to Professor Berila for coming here despite having a cold and going through everything to teach us.
Maybe the handheld is better, yeah.
To teach us students here, and I think whatever you have taught here has been very helpful for us. And since we are studying a traditional form of medicine, and you are here teaching us, what should I say, Chiluk Western medicine, I think as we go out, we aren't in the shoes of a doctor yet, but we have been in the shoes of a patient, and we know how important compassion is really. And you are here to specifically to teach us about compassion wisdom. I think the most important lesson you have taught us was that compassion is important. So I think on top of the main topic of the session, differential diagnosis, on top of that, I think that was a very important lesson for us. And I believe that everybody, including me, have kept this lesson in our heart, and we will use this in the future. And I thank you very much for coming here to teach us everything. And I thank you for your patience. Like, you're trying to explain everything to us. You're trying to explain it as simple as possible you could. So I thank you for every single word you're trying to say, you're trying to explain to us. And I hope that in the future we'll be able to, in a way, become like you. You're a Buddhist, and we are also Buddhists, and you're a doctor, and we'll also become doctor in the future. So I think you're a very, very good role model for us for becoming a better doctor in the future. So thank you.
Secondly, I would like to request Mr. Nimasrima to share his experience regarding this lecture.
First of all, good morning to Honorable Dr. Kerzin and our Sowa department head, Professor Kerzin, and sportsman from Germany, but I don't know his name, sorry. And all the our honorable teachers, staff members, and all the my Dhamma friends. Last 3 years ago, we meet near our university hotel. You and Kitash Tawala were talking. Also, Kitash Tawala introduction about yourself is that you are the doctor of His Holiness the 14th Dalai Lama. You came from USA. So my friends doing study about Tibetan medicine in Mexican. Kerzin asked that did you see you in Dharamsala? So she said that no. No, Kerzin said he is. You are the Dalai Lama doctor. So I feel very shocked that actually you are from Western, but you we are Buddhist monk. You are Buddhist monks. You can speak little bit Tibetan. So I'm very me and my old my friends are very happy to lecture, to listen your lecture, and also we are wishing you have very happy life, and if there is possible that you will be revisit in years. So we are requesting you also give us teach us modern medicine. Thank you so much.
Now I'd like to request our professor, Dr. Lobsang Tenzingwan, to share a few words regarding this lecture.
My English never walk, doesn't walk.
It's okay now.
It getting worse.
Yeah, it's okay now.
No. When I spent 1 year in the United States, my English is, I thought it's walking now. Right now it's become worse. 내 보기자 나와 아니 doctor 베리카스는 찍찍 너 바하고는 다 배제로
It's been very long since we have known each other. It's almost been like 20 years since we have known each other.
1992, isn't it? 1991 or 1992?
91. See, Sarnath Dukawangchen.
Yes. Before that, you can come to in the Mexico.
Really? 89.
Yeah, 89, definitely 89. That moment you are met letters, I think.
Yes.
Yes.
Yeah.
And after that, 1 year, he may become a bitch. Bitch. Bitch means gallon. And 일단 자 거기야 잡시다 된도라 스마트니 들바요니 네 세모하고 니지레스 아니 말한도 남 심비나노를 배 시부지 다 조건 예고지 그것은 플랜스
As Dr. Berega is concerned, he is very interested in all the politics, and he's been very sympathy. He's very sympathetic from nature, and he's very like he always very committed to any work he has done. And we also are very close to him, and we feel very touching whenever he visits us, and we feel like we are one family.
계산 디제니아 그런 대표네. 대표 자시다가 건조하고 그래. 90 maybe 2000 or some your negotiating in
Jela.
In many
Maybe
long time, maybe 1 month, nearly 1 month you stay.
Dawashi Dawanga.
He teach for us, for our students like Dawa telling. Maybe you are not be there. I mean, that moment we have not much in facility. Right now it's better than before here. And at that moment, I'm so sorry, Doctor. Daddy got a little bit sick, and he didn't got time to food or all those things. But still, working for us, sympathy for us, teaching for our students. And anyway, and I think.
No, it's coming back, Emma. It's returning.
No. You now have to take in the United States 1 year. Getting 10 years younger. Next 10 years younger. And then I know my English. Anyway.
Before he has...
계산 잠들으니까 음악 있는 거는 농가 중중지나 수수지 리정도 이렇게 해야 되나 되게 어려워.
Before Dr. La has visited our university, he used to be a visiting professor here. Dr. Sowa, Dr. Dalai used to be our student, but that time, due to lack of facilities, the facilities were not so good at university, but still you did your best to let students make aware that they know everything you have taught.
그래서 딱 괜찮은 땅나면 좋다는 아니 농가지기 내주를 지셔야 되는 비건 농가지기 독터를 있으면 되게 어려워.
Before, if we go back to an ages, it's okay to people know that you have one doctor in your community, but this days is not like that.
딱 괜찮은 글로벌라이제이션, 잠블링 충충 찾아봐.
Yeah, so it's the 21st century, and we say that it's like it's a globalization period.
Global becomes small. Yeah, very small.
So world has become so small that it's like very easy to know each other, and we become very familiar with each other.
그래서 대체인도 딱 너도 노비온데 너도 knowledge에서 올라왔다. 요새 시권이라면도 즉 신기 되잖아. 너도 짠 되게 합니다.
So it's not like we grab one particular subject and we it's okay to know just one topic. It's not like that. The world has become too small that even if you know 2-3 subjects, it's not
enough.
Not enough to know that.
세상 땅도 대체연도 땅도 땡 사보지 마셔버리는 땡 시고야도 빼개쳐 버리더라고.
So regarding that, it's very necessary for all of us to.
그거는 멤버적인 냠내 대마토 버리네요. 그래서 이제 나 근데 그 삼주연이 그 멤버 준비 차고야 지금.
So all the research, all the hard work we do, any kind of doctor may be, all the research, all the hard work they do is just to treat a patient. It's just for the benefit of a sentient being and to treat a patient.
그래서 대인당 주시고야 요틀로 시고야다. 요틀로 내주 시고야다 당한다고야 프리마스 개쳐버리.
So it's very necessary for everyone not to just stick to one subject, but act globally and think locally. We hope and believe that you will surely meet in the future, and if your time permits from your busy schedule, kindly visit our university and do give us some lecture on anything.
Not only lecture.
Not only lecture, but lecture.
Thank you very much.
Thank you very much.
And future, I never. Kerzin, long means I'm holding your. Thank you very much for coming.
As a gratitude, our department has organized a small gift for Dr. Berila, so I request Dr. Lobsang Tinsila to kindly you, Dr. Lai.
I'm very happy to be here. This does feel like a home to me because I know many of you, I know many of the other professors and students in the school in general, and many of whom I keep in good touch with. Geshe Owen Samtila is my patient, so we communicate sometimes about his health issues. He's very healthy. And many other people here. LNS, Shastri La, Losanova Shastri La is an old, very dear friend of mine. And so this is really like, and of course, Genla is a dear, dear friend. We're kind of like brothers for almost 30 years, I think. And so this is really very much like a family for me. Many of you I'm getting to know for the first time, but I'm sure that we'll continue to know each other and grow our family. So thank you very, very much.
Now I'd like to request Ms. Chimilamo to give a thank you speech.
Okay, now let me express a few words. Thank you. Actually, I could express enough gratitude for this lecture by Dr. Berila, but I would like to thank you by summing up in 3 points. First of all, I, on behalf of the Department of Sowa Rigpa, would like to thank you for teaching us about the differential diagnosis in a nutshell in 4 days, which was very interesting. And students also learned so easily from you because of your unique teaching methods. So it was very interesting, and thank you for it. And secondly, by joining this lecture, we have also learned the basic interaction method between the teacher and student. Yes, I think 99% of the students present here are inspired by the way you teach us. So you have really inspired us a lot. Thank you very much for it. And last but not least, we look forward to learning more from you in the near futures also. As you have given the Facebook ID and website ID, so we will look forward for it. And thank you very much for it. And thank you also to the cameraman and everyone who came here and join us and cooperate us to complete this lecture by Dr. Berila very successfully and happily and enjoyably. So thank you, sir, and thank you, everyone, and thank you.
Thank you, Lama.